So welcome everyone to this online webinar on Kenya's Single Registry. I wanted to first of all thank those of you who've joined the webinar either incredibly early or very late at night. We've actually chosen this slot on purpose to try and get people from both sides of the ocean to be able to join, and so thank you very much for those of you for whom this was actually quite a difficult task. I'm here as a moderator to give you a bit of a background to why and how this webinar was organized, and then of course I'll be introducing our speakers. About 3 years ago, Australia's Department of Foreign Affairs and Trade felt that there was quite a significant knowledge gap in the field of integrated data and information management for social protection. And while many countries were embarking on a process of integration, they were doing this in very different ways, facing quite different challenges and solutions, and they were doing it for quite different purposes and calling their final solutions in quite different ways. Sometimes, in fact, quite different solutions were called in similar ways and similar solutions called in different ways. There was quite a bit of confusion on this topic. So DFAT decided to commission a small piece of research on this topic that Richard, who is also joining us on this webinar today, and I carried out. This research then led to quite a bit of discussion, and we decided it would be quite useful to have an international workshop on the topic. We had participants from over 20 countries join us in Jakarta, had a very participatory discussion about what challenges people had been facing kind of when developing their what we're calling single registries today, and the workshop brought so much new evidence and kind of so many new ideas and experience to the table that we decided to update our report and to take advantage of the newly launched socialprotection.org platform to host an online community on the topic. For some reason I'm not managing to share my screen right now, but I really welcome you. You'll have all the materials to look at our online community, where we're trying to kind of build a repository of information on this topic, where we like to be facilitating discussions between people who have been trying to integrate data and information management for social protection, to get them to really share some of the practical tools that they've been using, what are the memorandums of understanding that they've used for data sharing, what are the data collection tools they've been using, kind of very practical solutions for practical problems. And one of the outcomes of this process within this online community has been to decide to host this webinar. And since Kenya is right at a crucial phase of the development of their single registry, we're really excited to have with us today Winnie Mwaziaji, who will be kind of giving us a first overview of kind of the process of developing the single registry in Kenya and what it's all about. Winnie is the National Coordinator of Social Protection Programs within the Social Protection Secretariat in Kenya, the Ministry of Labour and East African Affairs. She's been working in the field of social development for the past 25 years, social protection for the last 8 years, and she's really the person who's spearheaded the design and development of the single registry system in Kenya. We'll be joined later by Eva Mwangi, who is the Senior ICT Officer and MIS Coordinator at the Social Protection Secretariat in Kenya, and she'll be giving us a bit of a feel of kind of how the system works, and that will last about 10-15 minutes, and Richard Chirchir from Development Pathways, who's a Senior MIS Specialist who's been working in this field for 14 years and who is actually very much involved in the development of Kenya's single registry, will then give us a kind of his take-home points from Kenya's experience. So I now hand over the word to Winnie, and I hope you enjoy our seminar. We'll actually, I should be saying, sorry, that we'll have about half an hour's time for discussion at the end, and I'll be trying to gather all of your comments and questions and handing them over to our discussants. So, Winnie. I should have.
Okay, thank you very much, everybody. I think as a country, Kenya, we are very glad to be able to share what we have done so far in the field of the single registry. It's a young country. We started after learning so much from the Brazil, but I believe we have done enough to enable us to share what we as a country is doing. And I would like to say that we are proudly using the single registry as one of the solutions, key solutions that we are using to help us in terms of accountability. Accountability in social protection sector was one of our greatest challenge. So that is the main reason why, again, we really wanted to have this session, the single registry. I'll give you what my overview of the presentation. I'll look at what is Kenya single registries. I'll look at how it was developed, the timelines or the background of the single registry system, why it was developed. How does Kenya single registry work? Where I'll just touch a bit, and Eva will be able to go through and tell us how it's actually the practical way of how it works. Who can benefit from the single registry? What are some of the challenges and limitations we are facing as a country? And then we look at some of the future consideration for upscaling or enhancing the single registry system. So why did we have a single registry system in Kenya? One of the key things that made us think of the single registry is using it as a reference point. It's able to give us, like in social assistance, who is receiving social assistance, what types of assistance, because there are several kinds of assistance. For us to be able to have a complementarity in the different deliveries, we need to have what kind of social assistance that are being provided. Where are these social assistance? Who is receiving it where? And then what amount of transfer or what type of transfers are being given? So the single registry has really helped us in terms of, initially there were a lot of scattered information on the types of social assistance, but now it has brought them together under one system where we are able to see the different types of social assistance. Again, if you look at generally in the social protection sector, it has really been a key tool because it's helping us in terms with planning. It helps us in coordination of the activities that we are having, more so the social assistance component right now. Even in terms of monitoring, we are able to produce reports that are able to see what is happening within the social protection sector. It has also improved our effectiveness in terms of implementing the program. You remember I said, you could see from our topic that we say it's a tool for accountability. So it's helping us in terms of being able to effectively implement the social protection programs. Currently, we are only having the social assistance program. Basically, I'll talk of the cash transfers. So we are currently having about a households number 882,678 households already in the single register. And this is giving us about 2% of the population of Kenya, which is 40 million. So we are saying we are still very far in terms of uploading, and this is more so because we are only covering currently the cash transfer programs. That is how our single registry, the main page looks like. It just gives you roughly what is a single registry. You can be able to see the significance of the single registry. So it gives you just the picture of page where you are able to pick on what you want to look at. And then if you want to look at the information on beneficiaries, if you want to do the summaries of the reports, the statistical report, you want to look at the trend analysis, you are able to go to the page, the main page, and be able to pick what kind of information that you'd like to get from the single registry. And I said it has quite a bit of information on different things on the beneficiary. Why we decided to develop the single registry mainly is because when we're using our MTP, the medium-term plan for Kenya. And within that, the Vision 2030 actually says, brings in the issue of trying to make sure that the social protection is well coordinated. So the Vision 2030 really articulates the issue of the single registry system. And then we also developed a policy in 2012. The policy clearly talks of the need to consolidate the fragmented programs. We have started with social assistance, but we are seeing us going broader to be able to cover all the fragmented. So if you want information on all the programs in Kenya, social protection programs, you should be able to go to the single registry and be able to help you get the programs that are there, how they interrelate with each other. Another thing that in the policy that clearly articulates the issue of the single registry is the ability to scale up. In our social protection policy, we are talking of being able to scale up to be able to even do complementarity, graduate, scale up when there's droughts, when there's some kind of shocks within the family. So this is clearly able to allow us to be able to scale up effectively in the social protection arena. So the single registry is a very, very key tool to us towards this. How did we develop the single registry? When we came up with the idea of developing the single registry, we looked at which ones do we bring in first? What is the scope that we want to have in at the beginning? And we said probably it's good to start with the cash transfer programs. And even when we looked at the cash transfer programs under the phase 1, we were able to develop a single registry without the various MISs of the different programs being able to interrelate. So we had to look at the various MIS systems to make sure that the functionalities are able to relate to the single registry. At that particular time, is only the Hunger Safety Net program in Kenya that had a well-working MIS system, and the CTOVC also had something that was workable. But we said that if we don't have all the programs running at par, then we are not able to develop the single registry. So what we did, we came up with guidelines that we said, for you to be able to speak to the single registry, you must adhere to the guidelines. So any program, even in future, who would like to come into the single registry, they must be able to follow the guidelines that we have for the MIS. So the MIS must be built as per what is spelled out in the guidelines for the single registry. So after we had made sure that the 3 programs were able to relate, then we now developed the single registry. That is the phase 1. In 2013, we were able to come up with a well-developed single registry system. But again, there was still an issue because we needed to make it speak to be able to verify some of the information from the integrated population registry system. So we made sure that it was speaking to the civil registration, because for you to be able to do a lot of things, you still need to look at the data against the single registration. After that, during the same phase 2, when we were linking it to the integrated population registry services, we were also, World Food Program also have a lot of beneficiaries that they are actually taking care of. So they say that, because those are all social assistance programs, social cash transfer programs. So they also brought in their beneficiaries during that particular, in 2015, sorry. So World Food Program, the last year, they were able to bring in a lot of data, I think about coming to almost 10,000 households. So currently the single registry is carrying the data from the Hunger Safety Net program, the CTOVC program, and the older persons program, and the persons with severe disability cash transfer program. And make note that this is only the cash transfer programs that are currently in the single registry program. So what are we looking at doing this year and probably next year? We are looking at how then do we also link it with other information, other systems. For instance, we would like to know who are already receiving the social security, that is the contributory pension. So we'd like to in future be able to link it to that. Out of the cash transfer beneficiaries, we also have a lot of beneficiaries who are currently being covered by the National Health Insurance Fund. They're being given a health subsidy program. So we should be able to see how do we link the National Health Insurance Fund, and this will be able to give us the coverage in terms of health insurance. Then we'll also be able to be reporting directly under the national management, the M&E system that is for the nationwide. We'll be able to do an M&E and do reporting directly to the central. Kenya has a central place where we do all the reporting. So we'd like the information on the social protection be directly covered from this system, so that we don't have to come asking us, can you give us a reporting on this? Can you give us this? So automatically it will be able to report to the NIMIS, where it's a national kind of management information system for reporting. How is the institutional arrangement in terms of the single registry? The various departments collect their own data. That is according to Kenya. I know the Brazil, where we try to learn from, was a bit different. For us, Kenya, what we do is that we collect the information of the beneficiary that we want. We bring them, each program is able to put it in their MIS system, and then from there they are able to target. Then once they target, people who are targeted will automatically be uploaded into the single registry. So each program manages their management information system, and they are brought in as we continue targeting. So ours is slightly different because in the Brazil way is where they have the universe. They have done a survey and they are putting everybody in there. But Kenya, because of the issue of affordability and all that, we decided that we bring in the beneficiaries as we continue working. So when we enroll more beneficiaries, then we bring them into the single registry. It's more manageable for us, and we think it's affordable for us, and we are able to do it as the funds are available. So that's when we brought in the 4 cash transfer programs. While food program also manages their own database here, the MIS, but of course it speaks to ours. So automatically then the data that we require is replicated into the single registry system. So that is how the single registry works. But the single registry is actually kept, it is housed within the Social Protection Secretariat. So we anticipate that anybody else who would like their data kept within the single registry will be housed within the Social Protection Secretariat. And that's where the reporting is done. If you want the general reports of all the programs, then you're able to get that. So it's actually coming up with a consolidated way of doing reports in social protection programs. How is the staffing again done in terms of that? The MIS working group, we have constituted an MIS working group because if you're working as an individual, you are not able to make things move. So we have come up with an MIS working group which is constituted with representatives from all the cash transfer programs within the single registry. So we have representatives, some of them have brought in 2, some have brought in 1. We are yet to see how much data there is for us to be able to. So within the MIS working group, we also have a representative from the Secretariat who works with them. We have been very happy to have been supported with a consultant which is funded by the World Food Program and has really started with us from the beginning. They have still held our hands as they continue building the capacity of the officers within the ministry to be able to handle the single registry system. So, Development Pathway has about 3 officers right now on board. They have been hired by World Food Program to help us in terms of managing this and also building in the capacity of the locals to be able, all the people, the program implementers to be able to continue with this. So again, we have some components and each department has first of all, we have somebody within the Secretariat who is in charge of all the data that comes in. She ensures that this is well done, and she has some assistants that help her because the workload is quite a lot. Then within the programs also, we have specific people who are dealing with what we call the MIS coordinators, who make sure that the data there is good enough and they're able to completely replicate it. So they work hand in hand with the Secretariat for you to be able to maintain the right data that you need. The workload is still a lot, and I think we still require a lot. This is what we have right now as a workload. You look at the various departments currently are having 2 officers doing different things because we have different components within the single registry. Must be managed, no interference. So there's somebody who just deals with registration. There are people who deal with registration. So the program, still looking at the capacity of the program or the number of data that they have, like the Department of Social Development and Children's Services, they have 2 people doing registration each. Then we have people doing enrollment. So there's a kind of shared role and responsibility in terms of doing the touching, going into the century. And this is more, because I think that Desha will go into this, making sure that not everybody is able to administer every point. So that data is not changed at any time when anybody feels they want to change data. So you're given administrative rights. So you are only able to enter and be able to change just what rights you have. So we have the components of registration, we have the component of enrollment, we have pay management, we have also the complaints and grievance that is also being done by the various programs. And as I said earlier, currently our single registry system is linked to the integrated population registration services, and this has really helped us. It's currently having a data of about 30 million households, quite a big population in Kenya, and we have been able to verify the various things like ID number. For you to be able to be registered as a beneficiary, you must be a Kenyan. And what shows that you are a Kenyan is your ID. So your national registration number is what is going to show. So Kenya, we are able to verify that you are really the person. If you're Winnie, Winnie Mwasiaji, then you go into the single registry and query it, and you'll be able to get my ID number, where I come from, all that. So you're able to verify a lot of this information. And as I said earlier, we have a lot of data, and some of the data is very sensitive data, because when you're collecting data on households, there are a lot of other things that you collect to be able to make sure that this beneficiary actually qualifies to be. So you have a lot of data that could be a bit sensitive in terms of management. So we have come up with a data sharing protocol, and this data sharing protocol just articulates how you need to do the application if you want the data from that. And programs already coming, requesting for this data for them to be able to cover the kind of program that they are handling. So it shows application. How do you do your application? How does the application a process? How is it approved? How is the data being disposed of? What is your responsibility if you have that data that we have given you? So there's some kind of commitment that you are signing, that when you're signing the data sharing protocol, let's say that we have some document that goes with the data sharing protocol, you must be able to maintain secrecy in terms of the data management, because otherwise we'll have a lot of problems. It's still a big challenge. People want to come for it. We know how some people can also abuse data. So we are being a bit careful in how we handle this. We are also seeing that the single registry is going to help us in a lot of other things in terms of frauds. I mentioned earlier that beneficiaries, in fact, fraud can be at different levels. It can be at the officer's level who can register somebody that is not true. You can also find the beneficiary who is trying to register several times. So we are able to eliminate some kinds of frauds brought about by registration. We are also able to minimize some of the frauds that are brought about through payments, because it will accurately tell you how much you have gotten at any particular time. So the issue of efficiency and even accountability is very clear, and we are really proud of this tool, because we have been able to actually discover a few anomalies within the implementation of the program. In terms of efficiency, I think it has really improved our efficiency. Before, the data used to be entered, you would look at it manually, you would do everything manually. Right now, at a click of a button, you're able to generate payroll that will help you in terms of payment. So efficiency, we are able to do things a more faster way, and even when you look at the data, it's a better data. You could find that the payroll is done so many times, you get a lot of duplications in the payroll, you do a lot of things, but the schedules were late and were delaying with payments. But now we are more effective and more efficient in the way we are doing things. It's also helping us as a tool of monitoring. We are able to generate a lot of reports. At the end of this, I'll show you some of the few reports that we're able to generate. But I think Eva will go into details, and you'll be able to now see how the reports are even generated. So we are now able to generate, like if you want, for instance, you want to see how many people were paid, how many beneficiaries picked their payment in the last payment cycle. You are able to generate that. You want to see how many beneficiaries were able to make complaints that they have. You're able to see, and even you're able to view what kind of complaints were there. So you're able to generate any kind of reports that you want. So it's really helping us just by clicking a button, querying whatever you want, and you're able to generate. When you want to look at how many people there was a bit of people who are probably enrolled and there's a problem with the IDs, you're also able to generate that. And then in terms of planning, we have an expansion plan within the single registry, and we believe this will be help us in terms of even rolling out if you want to expand the program. So the expansion plan is there, giving us how many people we are supposed to bring in each year. So you are able to go that and be able to see how many people are we supposed to bring in this year and from where. So it's a kind of a tool that is helping us even to be able to cross-reference against whether we have attained our objectives of the program. And then in terms of emergency responses, we're already having one of the programs, the hunger safety net. So we're able to have a big detailed numbers. When they work in the northern Kenya where there are a lot of shops. So they are able to see how many people are they able to bring in during the emergency situation. And it's really helping us. We have not expanded it so much into the other programs. We are still using it also only within the hunger safety net program in the northern Kenya. But we are hoping that this will be able to be used in future across all the programs where we're able to expand when we feel that we should expand. I will quickly go through some of the samples because I know Eva will go into details about this. And if you look at just on the screen, it's giving a sample of the dashboard that we have. It is giving a different, at a glance, you are able to pick in to show what you really want to see. That like targeted beneficiary, you can see in 2014 and 2015, how are we moving forward in terms of being able to cover the beneficiary. In terms of registration, you're also able to see how many people we have registered so far. Another kind is disbursement. The kind of sample report that we get is the disbursement. I'll not go again into details, but it clearly tells you how much was disbursed in 2014, in 2015. You are even able to see by pie chart, just a pictorial look if you want to be able to, at a glance, to be able to see how the program is doing in terms of disbursement. Even trends analysis, we are able to go to the single registry and be able to see what are the trends or in terms of beneficiary households. How is it going up? Is it going down? Is it going up? Is this, sometimes when we don't have adequate funds, you see it going a bit flat. So you are able to actually go view at a pictorial at a glance how the trends of the various programs are. Again, you are able to look at the various, some small reports that I don't want to go into this because Eva will be able to take you through them and be able to see what kind of reports they are. In conclusions, some of the limitations that we have been able to have was, one of them was the getting the concept. For us to be able to know what do we want with this the single registry? How do we make people be able to get the concept of building a single registry? When we came back, making people really know what is all this thing all about was really a big challenge. And then the logistics of making sure that these things happen, all that was really a challenge. And then the Secretariat had to undertake massive investment to make sure the MISs of the various programs are working well. We had to look for partners here and there. That's how we are happy that we got one good program and the rest and the partners. And they came in because it's a real huge investment. If you're going for it, you must be able to have friends who are able to help you. Otherwise, as a government, being a new concept, making them believe that this can work, it's difficult unless you get friends who can first of all jumpstart you to be able to do this. So the resources were really a big challenge. It's still taking in quite a lot because we continue enhancing our single registry. Even the little enhancements that you're doing really takes time and a lot of both human and financial resources. So what do we want to do in the future? One of the things that we want to do is, if you look at my earlier picture where I talked about being able to expand the single registry to be able to cover other programs. And we think the most important program that we want to cover at the beginning is the National Social Security Fund. In our policy, social protection policy, those are the three components: the Social Security Fund and the National Health Insurance. So our policy has three components. One is social assistance, health insurance, and social security, which is contributed. So we want to make sure that all these things are brought within the single registry. It's a tall order, it's a dream, but we are hoping that we will be able to manage that. Another thing we want to do is that because we work with other partners who are health sensitive, and I think children things are also very key in being able to address it. And we are saying that if you are able to address children's issues early, a lot of these programs that come in later will not be there. So if you are able to handle it at the child sensitive level, and we are able to do issues that work with the children, I think we'll be able to move ahead. So we are looking at some kind of child sensitive reports that will help us in terms of addressing this. So that it helps us in terms of management, planning, and being able to do things that do with children. We have already been able to generate some reports with UNICEF, in collaboration with UNICEF, and I think that will help us to move forward as a country. Then we want to bring in other government institutions, and we also want to bring in issues like counties. The county governments are doing a lot of social protection intervention right now. We have already some counties that are doing cash transfers, but we are not able to know whether we are doing the same thing, whether we are reaching the same people, whether we are doing. So we want to be able to communicate further for them to be able to understand this, make sure that even them, they are able to use this very important tool. We want everybody to be able to use it because it's a country tool that will help us in terms of enhancing delivery of social protection in the country. So if we are able to convince all the rest, I think that will be able to help us. And then also we want to use it for, we are trying to pilot electronic registration. So as we pilot electronic registration, we want it to automatically be able to replicate itself into a single registry system. We are thinking this will also help us in terms of being able to quickly do our targeting. Because when you're using electronics, if you go electronic, let it go electronic, and that enhances your delivery and fastness in terms of doing things. So we want to be able to pilot that. The issue of sustainability, I told you resources. Resources is a real big challenge. And first of all, we want to be able to look at what support or what kind of mechanism can we put in place that, so that even if the donors go today, our partners are not there today, the Kenya government is able to run this. So one of the things we want to look is, we want to look at some of the examples of existing kind of management information system and be able to see how are they managed? How have they been maintained? How can we make ours also sustainable in terms of because that is going to be a challenge. So today, if one program says they are going away, tomorrow I don't know what we will do. Of course, so we are trying to come up with plans and being able to see how are we going to address this issue in future, because the government must first of all own this. And our government has already owned it. And I'm proud to say that in the next financial year, they have already put in something to slowly take over what the partners have been doing. It's a huge investment, but we believe as a country, they are committed to be able to use this as a tool for development. Thank you very much.
Hello, everyone. Yes, next we have Eva, as I said, that will be showing us some practical examples from the single registry. So she'll be actually kind of walking us through the functioning. So Eva, please, the floor is yours, and you have 10-15 minutes max. Let me hand it over to you. Change presenter. There you go. Eva, we cannot hear you right now. I think you need to turn your audio on, possibly. Sorry.
Hello, can you hear me now?
Yes, ready to go.
Yeah. Okay. Okay, thank you very much. So I'll be taking you through the single registry, and I'll be showing you what Winnie has been talking about. On our homepage, we have just an infographic showing where we've come from, how we used to do things before. And as Winnie mentioned previously, most of the programs are working independently, and we had a lot of queries that were coming in. It was difficult even to track programs. So that's just a representation of how we things before. Down below, we can see now how we are working and the approach to the single registry. We have the cash transfer program for hunger safety net, the WFP Jenga Jamii program. We have the CTOVC, the Orphans and Vulnerable program. We also have the the Older Persons program and the Persons with Severe Disability program, which are implemented under the Ministry of, under the Department of Social Development. So these 6 cash transfer programs are currently linked to the single registry. And we also have the population register. Remember in Winnie's presentation, she mentioned that the programs are for Kenyan citizens. And we are using the population registration service under the Ministry of Interior and Coordination to validate our beneficiaries, whether they are truly Kenyans. So these are the systems that have linked currently to the single registry. Just below is a demonstration on what exactly the single and what the data it holds, and some of our partners at the bottom. So the single registry is divided into 2 sections. We have the restricted area and the public area. Public area is accessible to anyone who has internet access, even to you, our audience. And the second page looks at a summary statistics of all these cash transfers that I've mentioned. Remember when we showed you the screenshot? So for me, I'm showing you the actual single registry and the data that it provides. So we have the first graph that looks at the household beneficiary, and this is as at 2014, the year 2014-2015, which is a financial year, and you can see the numbers. You can see the numbers of these beneficiaries. There we go. So these are the targeted beneficiaries. We have registered households. The next chart, looking at the registered households. Going down, we have a summary statistics by sex of the household heads for each cash transfer program, and you can see most of the programs are the female, mainly the household heads or the individuals receiving the cash transfer on behalf of the households. We have a pie chart just showing us some representation of the registered household, and majority come from the city of the orphan and vulnerable program and the older persons cash transfer program. Going further down, we are looking at the budgeted disbursement, and you can see the figures. This is in billion Kenya shillings, and the next graph looks at the actual disbursement, what actually went out to the cash transfer beneficiaries. So this is just a summary statistics for anyone who wants information regarding the cash transfer programs and any of the social assistance programs that are linked to the single registry. They are able to access this, at a click of a button on one page. Now, if you want to go to further details, we have the beneficiary tab. And under the beneficiary tab, we have summary statistics again. And the good thing with this, it gives you different representation for you to look at. We have the grid, and we have the chart, the pie chart, and also we have a histogram there. You can track using the financial year. So what is currently showing is the 2014-2015 statistics, but you can go back to 2012, 2013, or any other financial year to just see the numbers. And you can see previously the numbers were very few compared to the numbers that you have as at now. The next tab looks at the disbursements, and this is the amount of money that has gone to the beneficiaries in terms of cash transfer. As I mentioned earlier, this is in Kenya, 1 billion Kenya shillings, and this is again statistics for 2014-15, and you can go back to just see how the funds were being issued out or disbursed to the cash transfer beneficiary. So this is for financial year 2011-2012. The next tab looks at trend analysis, and the trend analysis can be done either showing how the number of beneficiary has increased over time, or you can also look at the disbursement, how the disbursement have gone over time. So we'll start with the beneficiaries, and you can select either all to just show you for all the cash transfers in the program. And these are the numbers, and you can see most of the programs, the numbers have been increasing. The number of beneficiaries has been increasing in thousands up to now where we are at. We can also query by program if you want data regarding a specific program. And there this is data regarding cash transfer for orphan and vulnerable, and you can see how the numbers have been increasing over time. You can also generate a trend analysis for the disbursement. Again, we can try, So this is trend analysis for the orphan and vulnerable cash transfer, and you can see how the cash transfer has been increasing in billion Kenya shillings. You can also query for all, the same with the previous graph that we looked at. And one good thing about this single registry is that previously generating such a graph, you'd have to make several visits to all the cash transfer programs to just get this data, then sit down and try and generate this kind of analysis. But with the single registry, it helps us do some of this analysis right at the click of a button. You don't have to don't have to come to our offices to get data or statistics regarding the cash transfer programs that are linked. You can log in and access this information. We have a maps section, and the maps just gives us an outlay of a graphical representation of map of Kenya and the cash transfer beneficiaries and where they are. It may take some time, and I don't want to run out of time, so I'll move to the reports section. And in the public area, you can generate a report just giving statistics of number of beneficiaries. Remember, we are very keen on issues of data protection, so we are not giving out specific details of the beneficiaries that are being covered. We just have numbers, summaries for the program. So you can select a program that you want to generate the numbers for, and you can go to whichever county within the country to generate a report regarding the numbers for the program. So this is a query for Nyandarua. We can select Kinango. And there you go. So it gives you summary statistics of just summary statistics showing the number of beneficiaries within this county, and it disaggregates the data by geographic location, constituency, division, location, up to sublocation level for beneficiaries. We have also linked the complaints and grievance system to the single registry, and you are able to enter data directly from a toll-free line. And issues that are received through the toll-free line, they are entered directly through the complaints system. We have a staff sign-in, and this is the section for the county officers or other staff that are allowed to access. I'll log in and show you a few I'll show you a few of just the statistics or new additions to what the data has. So as I mentioned earlier, we'll not be going into details on the restricted pages, but a few tabs are added that allow the officers, even at the field level. You don't have to be in Nairobi, the capital city of Nairobi, to get this data or to visit the headquarters. You can be in whatever county and still be able to access this data. So we have, for the officers, they are able to do a bit of comparison for the beneficiaries, and the payments section, looking at the numbers collected and received. It also has a trend analysis to just allow the officers to see how the cash transfers have been moving, including complaints that have been made. We have an inquiries tab, and this one allows the officers to query in case they are receiving citizens who are coming wanting to find out whether they're in the program, or if they could, if they're not receiving, maybe it's a beneficiary who's not able to receive their cash transfer and they want to find out what is happening. The officer at the field level is able to use the inquiries module to query the details of the beneficiary. So we query by ID number, and we also query by household, we also query by household number. We have an M&D section, and this is specifically useful for M&D officers. And the single registry captures specific indicators that are regarding the National Safety Net program. And the M&D officers are able to generate reports directly from the single registry rather than visiting the different programs. Remember, as Winnie mentioned earlier, the programs that are linked to the single registry are implemented by different agencies and are located in different areas across Nairobi. So the officers, the M&D officers don't have to make visits across Nairobi to get this data. They're able to generate the report through the single registry. As we mentioned earlier, we normally validate our beneficiaries using the IPRS check, and this section allows the officer to query an ID, and it tells us, you query the ID and it gives us the detail on IPRS, and if that particular ID is in the single registry, it will alert us at this section. If not, it will just inform us that there is no beneficiary who is linked to the single registry. We have specific reports that are generated using the single registry, and we have the numbers, beneficiary number summary. We also have a detailed report now giving the names and the details of the beneficiary. We have a caregivers report. Some of our beneficiaries, especially for orphan and older persons program and persons with severe disability, they need another individual to take care of them. So it's a key report for program implementers, just to know who are these caregivers that are taking care of our beneficiaries. We have an exit report, and this is mainly for beneficiaries who've exited. We want to see why they've been exited and when they were exited. We also have a summaries report that allows us to see, just in summary, what are the numbers that have been exited over a certain period of time. For the orphan and vulnerable cash transfer, we have some households that are child-headed households, and we generate this report just to show us this child-headed household and who are these children and how old they are, and it helps us in planning and looking into ways or measures that can be taken to assist such households. We have the payment cycle details. This one shows the cash transfer, how it has been received, who has received, and whether they've collected for this for a specific particular payment cycle. We also have summary by county, just showing the payments that went out to specific counties, and we can also do a summary by cycle. We have a report that shows us the grievances that have been made by type. We have a category, a list of grievance type, and we normally want to see grievances that have been received by this specific grievance type. We have a change management report. Sometimes there are changes within the beneficiary data. We want to see what changes have been made. Was it were they changing a caregiver? Were they changing maybe their location? What kind of change has been made on the beneficiary data? So we generate the beneficiary change management report. We have an IPRS summary report. This one is specific to just show us what were the variances between our query to the registration service and our data. Were there variances? So the summary just shows us in terms of numbers. The next report is a detailed report, now showing specifically these were details in the IPRS and these are details in the single registry that had some differences. And this allows our program officers to now go back to the field and try and sort out some of these issues that arise from the IPRS. We have double dipping. Remember, at the moment as a country, we may not be able to give cash transfer, more than one cash transfer to a household. So we normally want to see, are there households that are benefiting from more than one program? And this generated across program. And we also have another one that now looks at double dipping within the program. Sometimes some households are fraudulent, so they'll register maybe with one spouse and then again register within the same program but with a different spouse. So we want to see, are there such cases that are happening? So this is a key report that is normally generated. We have a setup section, and this is for the MIS coordinators and the ICT officers to create users of the single registry. Of course, these are the change password and the logout. And in a nutshell, that is the single registry. And thank you very much.
That was incredibly useful. Thank you very much. Before I hand over to Richard, who's going to give us some insights kind of based on Winnie's and Eva's presentations. He's going to give us kind of what the key take-home points are kind of for other countries who are embarking on similar processes. Because before I was unable to share my screen, I just wanted to quickly show you the online community where we will be posting a link to the recording of this seminar. We've realized that we've got over 101 people and this platform can only host up to 100, so that's amazing that we had so many people interested. Some of you will have to go back to the recording later if you were not able to join. This is our online platform where we'll also be putting some of the materials that kind of from the Kenya case studies, and where we've been collecting all types of materials from other countries as well. So I do welcome you to try and join. And in the meanwhile, I've been receiving lots of questions from people from the audience. It's amazing the amount of interest that this has generated. I will be slowly answering as many as possible in the discussion session, but we will be answering the rest afterwards in case your question is not addressed. I'll now hand over to Richard. And yes. Richard, you should be.
Yeah, just a minute. Okay, I think, okay, great. So I think thanks so much for listening in. I think with Eva's and Winnie's presentations, I think the key question that comes to mind is, so what do we learn from Kenya's single registry model? So I think I've got more or less like what I call 6. I guess they could be 10, they could be 15 and more. But I think for this particular session, I think I just more or less like want to drill down in terms of what are these key 6 important lessons. The first one is, I think which we've always emphasized is the single registry should be construed as a policy tool. Okay, I think the first key priority is it needs to be seen as a policy tool. It's not an ICT tool per se. So I think what is the greatest more or less like lesson that you get is Kenya's SP policy was able to envision this. It underscores the need for single registry and also envisions the setup of individual program MISs with functional MISs populating the single registry. So it more or less like define the model. So we never even struggle when you're doing the feasibility study. I think the second important point to make is we should invest in quality single registry design. I've seen in a number of African countries, for example, it's very clear that the SP policy calls for setup of integrated MIS, of single registry. There can be many variants in terms of the names. But I think the fact that the policy calls for that does not mean that you just jump and do it. So I think what the key point I want to make is there should be investment in what I call the feasibility study. So in Kenya, this was done in 2012. I think Winnie may have alluded to that. And it should cover a range of issues. For example, it should clearly articulate objectives. So there are a number of, so in Kenya, for example, we know the objectives are planning, coordination, and monitoring of the programs. It could be different in other country contexts. Scope and rationale, potential supply and demand impacts, negative impacts if they're there, and also the key aspect in terms of the linkage, to civil registration systems, potential models, and then potentially, for example, the costs that could be in terms of developing the single registry. The other key, the third aspect, which is so important, is you need champions at the policy level and also at the technical level. And I think so this has not been particularly problematic in Kenya. The first thing is, I think Winnie will also concur with me, the single registry was at some point in the cabinet secretary's performance contract. at the Ministry of Labor and East African Affairs that made men in terms of propelling that forward. SP Secretariat, I must say, has also been extremely helpful. They've always seen the Single Registry as their baby, driving it and actually more or less like helping in terms of the setup. The MIS working group has been extremely helpful. And we know, for example, that unlike private sector, where there is normally a very well-established IT unit with very strong system analysts who can be able to, in government, this sometimes is a bit weak. So the MIS working group more or less like help to be able to fill that particular gap. And they've been signing off specific milestones at every stage of the development. And then I think the donors have done their part. DFAT provided the initial financing. World Bank made it a part of their disbursement linked indicators in terms of the National Safety Net Program. And World Food Program is supporting the current phase with broader enhancements, documentation, branding, and electronic registration, more or less like decentralizing the access of the single registry. The fourth point is, I think we should be able to develop and implement capacity strategies. I think Winnie already mentioned, I think the key focus in cases is phase. So I think as part of the initial phase, there's been a detailed capacity needs assessment. You already know, for example, the key challenges that our MIS officers actually face, the key areas in terms of the skills that we need to be able to strengthen. And with that particular report, what needs to be done now in terms of that is implementing the recommendation from that particular report, so that as the single registry is handed over to government, it means the government will be able to do the maintenance and there will be enough capacity to be able to sustain it going forward. The fifth important aspect to be able to elaborate also is I think we should be able to pay close attention to technical aspects. I think it's good to say, for example, it's a policy tool, but also there are some aspects that are also important as you evolve and develop the single registry. And I think one of it is data security, access, sharing protocols. So I think personal data is extremely need to be protected. So I think we are happy that already in Kenya, the data sharing protocols have been developed and they're being rolled out. That means that that's why, for example, there was the public view and there is the private view. So that if you want to have access to the private view, then there is going to be a signing. You make the request is assessed, and then once you have the approval, then you can be able to have access to the private view. The other aspect is as the programs grow, in terms of the number, the volumes, you're looking, for example, a WFP bringing in on board an additional, for example, more than 400,000. It means, for example, the databases need to be able to have the capacity to be able to scale up. So aspect around sizing and performance need to be actually thought through, very, very careful. The number of transactions that the single registry will be able to host, it needs to be designed well to be able to do that. Hardware and software specifications, very important in terms of the upgrade of the hardware. The specs in terms of the licenses for any proprietary software that may have been used in terms of the development. Data backup and recovery strategies, they need to think through in terms of if, for example, the Winnie's office, which is where this is hosted, were to, God forbid, for example, catch fire or something like that, what would happen to the data that is actually being hosted there? So they need to think through in terms of options for off-site backup for that. Then technology platform. I think the key aspect is it nearly nowadays, for example, any solution that is being developed needs to be needs to have the capability to be able to operate on the internet and the web. I know people can ask me, for example, but what happens in terms of, say, access in some remote areas where there is no internet connectivity? Having a web capability, for example, can still give you the option to have an offline module to be able to function that. But having a system that is not web-enabled will give you challenges when you have a bit of web functionality. And then I think finally, I think we need to emphasize the fact that the source code will always have to go to the government. It's government-owned, it's government-led process, and the source code will always have to ensure that it's actually handed over to government. The sixth and the final point I want to emphasize is the Kenyan Single Registry, as Winnie already more or less like explained, has been developed in a phased manner. Why was that necessary? I think, of course, I think it has been important because there are a number of considerations that phasing helps. One is it ensures that you're able to manage several sub-projects or components. For example, enhancing the individual program MISs to make them functional initially. Then you're moving into linkages to civil registration systems. So you're able to handle several sub-projects in a way that you actually don't fail in terms of the implementation. But the other important advantage of phasing is, then if you have any challenges in the previous phase, you're able to incorporate them in the next phase in terms of the lessons. And then I think the other key thing is there is less risk of failure, especially when there are a number of competing projects being implemented by the government. I think typically, for example, when you have a policy, then you have an implementation plan, single registry project is going to be just one of the sub-projects. Actually implementing, for example, a big policy framework in government just looks like landing so many aircrafts. So the government will not be giving you all the time and the energy on one particular specific project. So if you actually more or less like do a big bang implementation, you may not get the time and the commitment immediately to be able to do that. So if you face it, then it means you more or less like reduce the chances of actually failure. I think the other aspect is capacity to operate and administer MIS is normally sometimes weak. So a big bang approach may overwhelm if you actually do something and you want to ensure that it actually gets finished or concluded quickly. The other aspect is social protection policies and programs in many developing countries are still at a relatively young stage. They're still evolving. So also I think, so if you were to say, for example, I want a project to be completed, say in 2 years, and systems are still evolving, it means what you will conclude and sign off may not be what the government will take forward on year 3. So staggering it also, that helps in terms of ensuring that, of course, as systems evolve, then that helps in terms of strengthening that. And then finally, I think just to mention that the fact that with like any other ICT solution, the key aspect that has to be emphasized is actually the business requirements or the business processes, and there are many systems. So those ones have to be strengthened alongside the building of the single registry. So I think with those few remarks, those more or less like what could come into my mind in terms of what we need to emphasize in terms of the key lessons that we could be able more or less like to learn from implementation of Kenya Single Registry. I think, thank you very much. Over to you, Valentina, for the Q&A session.
Oh, okay. I've just been told I didn't have my microphone on. Apologies. So I've had an incredible amount of questions flowing in, very practical questions, very targeted questions, kind of falling into 3 or 4 broad, and I wish we had time to answer everything. We probably won't manage, but our presenters will already have a lot to put their teeth in, because it's they're very interesting questions. So I'm going to start with one category, which is around the role of the national ID and the linkage to the population register, and how this is done in practice. Secondly, how it affects the inclusion of categories of people who do not have kind of, or most vulnerable, do not have access to a national ID. So stateless populations, child-headed households, so children, street children, and other categories who might not have an ID, and how that is tackled. And I think, yeah, so let's start with this question around national ID, and then I'll move on to the next lot.
Okay, thank you very much. You can hear me?
Yes, we can hear you.
You can hear me now?
Yes, perfectly.
Okay. Yes, so in practice, what happens, the Ministry of Interior and Coordination does the registration of persons in the country, and they are mandated to give every Kenyan citizen they're mandated to give every Kenyan citizen the national ID. We have cases, as mentioned by one of our participants, where we have the child-headed household or people who may not have access to these IDs. For child-headed household, we are working with them to have the birth certificate as their document of validation. Currently, we collect the birth certificate details of the children. The IPRS, or the Population Registration Service, links to several civil databases in the country, including the passport, the death, and other civil registration. They are yet to finalize the birth linkage to the birth database, but we are working with them to validate the already collected birth certificate numbers that we have. For areas where they are more vulnerable and they may not have access to getting these IDs, we've been working with the National Registration Bureau to set up camps to allow such beneficiaries to register for IDs. So we have had cases, I would call them interventions, where we've gone with the National Registration Bureau officers to actually do registration of ID and with this household. So for the single registry, we have a virtual private network between the single registry and the IPRS database that allows us to query their database. So we query the details of the individual based on the ID number that has been given. So the ID number is our primary key, and we use that to query the database, and it gives us back details of this individual, the name, their geographic location, and also their year of birth. That allows us to validate now with the data that we have within our system. I hope I've answered correctly, or as the participant.
Maybe just to add also that why we use the national ID as the form of being able to identify personally, because even at the bank, you cannot go without a national ID. So that's how, but we are ensuring that we don't exclude the children, especially who are vulnerable and have not reached the age of ID. So they normally have a caregiver, and this caregiver will take the identification number, and that will help the child in terms of being able to access the benefit. Because even if we give the child the access to the benefit, they will not be able to go to the bank without a national ID, because the banks also have to make sure that there's security in terms of the withdrawal of the funds. We are making sure that nobody is excluded just because they don't have a national ID.
Okay, thank you very much. That was a very useful response. I hope that answered kind of the questions from our audience. The next kind of group of questions was around your institutional setup, and specifically whether the different programs that you've talked about, the CTOVC, the HSMP, whether they're managed by the same agency and ministry. Can you hear me? Can you hear me? Hello? Hello, can you hear me now?
Hello?
You still cannot hear me. Hello? You still cannot hear me? Hello? Can you hear me? Can you try and speak? My microphone is on. Apologies. Sorry.
Cannot hear.
Hear me now?
Yes, now we can hear you.
Yes, okay, fantastic. Apparently the problem was with Eva's system. I'm not sure why, because my microphone was always working. Anyway, it it should be fine. We've got our technical people at our backs. So that the next set of questions was around the institutional setup for your system, and first of all, whether the different programs were all managed by the same agency and ministry, so HSMP, CTOVC, and whether the data collection tools were the same, or kind of you'd made an effort to make them similar across these programs to be able to allow for integration following a similar scheme. And related to that, kind of whether what type of institutional relationships you have in terms of data sharing with NGOs, the private sector, and other agencies and organizations that have actually been collecting data for social protection purposes kind of for many years now, including not only for cash transfers but also food transfers. So we know, for example, that you've been coordinating with WFP, but what about FAO, UNICEF, and other international actors? So that's my next set of questions.
Okay, in terms of institutional arrangements, we have currently the 4 cash transfer programs. 3 of the cash transfer programs under the Ministry of Labor and East Africa Community, but they are again under 2 different departments. So there are 2 cash transfers that are under 1 department, that is the Department of Social Development, and then we have the one for children under the Department of Children's Services. Then we have the other cash transfer, the Hunger Safety Net program, that is under another separate ministries. But we are working together. We have formed some kinds of technical working group that looks at different issues. So they are almost like one because they are under the National Safety Net program. We have consolidated them under the National Social Protection, National Safety Net program, which actually harmonize most of the systems and structures that we have for implementation of these programs. So they are under different ministries or different departments, but they are actually run almost in the same way because of we have set up some guidelines and protocols and things like that that makes us be able to implement them in kind of a similar way. Of course, I'll say that they have been targeting separately, but we are currently working at a harmonized targeting tool to even come up with the electronic solution for registration. That will even help us better. So we have looked at the common parameters that are looked at, which are basically the same. They are all looking at poverty. So the parameters for poverty are the same. The only difference within the program are the categories that they are looking at. So we have made sure that we have brought in all the parameters that they require to win and to look for, and we have brought in the kind of category each program requires to put in place. So we are coming up with a harmonized kind of, it was actually piloted, I think last month or sometime, last month, this month sometime, and we are going to use it. We'll roll it out very soon in terms of being able to implement it. In terms of sharing data with other people apart from the World Food Program, we are trying to bring people on board slowly, and that is part of our phase 2 in terms of bringing in other ministries, bringing in other organizations that are working with that. Of course, the NGOs are we have tried to bring them in, but some of them are also a bit sensitive with their data. So we have to first of all be able to communicate and tell us what are the advantages of having this data as one. So again, I think we have to do advocacy for people to get the buy-in and see the importance of for this program. So we have not reached that, but I know USAID has approached us. They are trying to see how, because they are working with orphans and vulnerable children, they want to see how their data is able to relate to the single registry that we have. So that is one of organizations that to be able to use our data source base to be able to also bring in their data. But a bit some of them we need to really do a lot of us to be able to get them on board.
Fantastic. I don't know if anybody wants to add anything on that topic, or should I go ahead with the next questions? I'll go ahead. Right. So there were quite a few comments around the fact that your registry is quite particular in the sense that it's consolidating information from 3 existing or existing MISs. In fact, it's a beneficiary registry. Is focused several times on kind of beneficiaries and not on the wider population of potential beneficiaries. And quite a few people wanted to understand how the integration of other social protection related services and delivery systems. So for example, some people were asking whether you had any approach to kind of having a case management, kind of directing and referring people to other social based on your single registry. Quite a few people wanted to know more about this integrated approach you have to grievances and complaints handling, and some quite specific questions, kind of who this was being run by, whether kind of this is the same system hotline, whether it was just the hotline or whether there were other kind of systems for interview. A few questions on that, and a couple of questions on something which you've just mentioned, which is actually on the harmonized targeting, because right now the different programs are conducting their own targeting, and kind of what's the way forward on that in terms of harmonization. So I'll leave that to you again. I cannot hear you now. You might need to phone.
Sorry about that.
Yes.
Can you hear me now? Okay. I was saying about the integrated approach to case management. What I'd like to mention is that single registry is relatively new, and integrating even the monitoring and the reporting is also a relatively new idea to us. But we are currently implementing a national toll-free line for complaints and grievances that will make complaints or grievances through a telephone line, and we are trying to incorporate this to also include email or even visits to, and we have the WFP has supported us in coming up with a complaint system, the Sugar CRM. So we are not using the WFP system, but we are using a similar system to manage the complaints and grievances that are received. And at the moment, we've just set up the call center, and we'll be using this to just take in the complaints and grievances that we receive through the telephone call, but we're also encouraging the emails or even visits to our field officers. In future, we hope that we'll use the same system for our field officers to record the complaints and grievances that they receive at the field level. So we don't yet have an integrated approach to case management, but we are using each MIS or each program is currently using their grievance module within their MIS to record this. But in near future, we are working towards using the Sugar CRM to have an integrated approach to that.
In terms of the targeting, remember I said that we have just developed a common targeting tool that was just piloted across the cash transfers. It was just piloted a few this month, sometime early this month. So we are still trying to see, and I said we are now working towards use the kind of registration. So we still don't have, and we have to draw one plan where target together. Of course, only they cannot bring all the other social assistance to be able to target together. But we want to make sure that what we look at as poverty is the same across all the programs. So what it is, like the other day we had a meeting with the health and cover the very poor with the health subsidy program. And they're saying that we need to come up for us to be able to know when we go targeting this, looking at them. Whoever goes, even if I go, I'm able to target them because we are viewing those communities or the beneficiaries in the same kind of mirror. In terms of case management, it's difficult to do it within the single registry because currently we are only having the cash transfer programs. Of course, within the four cash transfer program and the World Food program, and see how we are able to help each other. Currently, case management, in terms of even referrals and all that, we are still not able to do that. But we are hoping in bringing in more assistance program, social protection program. We are able to see where the gaps are, and then we'll be able to make sure that we refer them to the service provider who is able to give the kind of services that particular person needs.
also I think wanted to add a point. I think the key question is, so once we have harmonized targeting, what will happen to Kenya's single registry model? Will it remain in current structure where you populate the warehouse with information? My sense is, even if, for example, there's going to be consolidation, say the disability benefit child elderly program into one harmonized system, there's still going to be the relevance of the single registry in Kenya. Because I think, as Winnie already explained, the plan is to be able to move out to link to, say, National Social Security Fund. That is, so there's always going to be the warehouse, which interconnects to other subsectors, social assistance, were to be able to build one targeting database and one MIS. That's how I see it.
Okay, thank you very much. I'm moving towards, I'm trying to consolidate quite a lot of questions into little bundles. Kind of the next bundle is about your actual reporting. So Eva showed us very usefully kind of what your main reports were. We had 3 quite specific questions on whether you had a tool to also monitor progress and impacts more widely kind of within the single registry, whether you had information about transfer modality of the different so how many were being reached through bank account, post office, what transfer modality each program uses, and about tracking real-time disbursements, whether that's in plan. I'll hand this over to you again.
Okay. Okay, thank you. For the impact assessment or impact evaluation, we do not have reports that address that at the moment. But we do have impact evaluations that have been done on this cash transfer program, and they rely on some of the data that the single registry uses. On transfer mode, it's an interesting to it. Most of our cash transfers are through bank accounts, but we've never quite had a report that looks at which per se, or whether it's PIN or fingerprint. But that's an issue maybe we could add in future. Yeah. Oh, sorry, tracking? No, at the moment we do not track real-time payments through the single registry. But one of the payment service provider does that, and that's for the orphan and vulnerable program, persons with severe disability, and the OSPA. So the payment service provider has a different portal that normally tracks how the beneficiaries are collecting their funds. We hope that in the near future we'll be integrating the single registry to this payment portal.
I'm going to clarify that also. I think in addition, I think we get at the single registry level, we're able to tell what payments were scheduled to a particular beneficiary and whether that particular beneficiary received the payments or not. I think if you're talking about tracking the payments to mean the number of withdrawals in that particular account and all that, I think we don't track that. I think what Eva is clarifying in terms of there would be the portal with the payment service provider that can be able to track that. But what the single registry does have is a payment went out for this particular period to this particular beneficiary, and there's a report coming back showing whether that transfer was collected by the beneficiary or not.
Okay. Another small group of questions is around what your total investment, kind of your costs up to now, maybe to make this process faster and cheaper potentially. So if there's anything you would have done differently, and your relationships with the developer. So in this case with kind of Richard and Development Pathways, kind of how was he involved? How are you going to be addressing kind of ongoing changes and strategy that you may need in the future in terms of sustainability? I think your microphone might be off. This may be sensitive information, so don't feel like you have to share everything. But
no. We have the amount, but I don't have it here. I don't think it's something that you really need, but we are, I don't have the exact amount here, but we can promise to give that later. Because I know we were trying to track down how much we have spent so far. So I know we have it somewhere, but I don't have it. It's quite a bit of money. We should people later. Our relationship with our developers, I think we are very close. He's always with us. He's been moving with us. Every time I want, he's a phone call away. Even when he's away, when you call him, he gets back to us quickly when we send him an email, and that's trying to walk us through. They've been working very closely with Eva because they are actually in touch with Eva throughout, and a very, very good relationship. Even at the time when the contract was off a bit, I think I could secretly still call him and give us support. So you must actually develop a very good relationship, otherwise you fail.
So it's an ongoing kind of rolling contract. I think for other people who are thinking of making these, that's how so you can continuously make adjustments and changes depending on your needs. Is that good?
Yeah. Another point, I think I've quite recently had a number of terms of reference for setting up this kind of systems. A number of other, I think two approaches to all this. I think in Kenya, there was not one large contract start to finish today in 5 years. So for example, I see a number of terms of reference where there is a bit of development of a 3-year period, design and development of a 3-year period with a 2 years of warranty by the supplier. So the supplier, for example, has a 5-year solid period. And on the ones that I've actually seen getting tendered out, I've seen estimations coming actually up to $1 million for that particular size of contracts. So the Kenyan one, the way it worked was, and I think again it goes back to the phased approach. I recall very well during the development of the individual program MISs, it was a bit of a very short contract to actually build those individual MISs with a bit of the bigger vision. Then there was a bit of the design of the single registry. And then, of course, I think this moved over from one particular donor to WFP currently. But looking at that, I think Winnie was right in terms of you need to be able to lobby the resources. You need to carry the vision. Then you need to be able to lobby resources to be able to achieve what you actually want as a government. So I think there is a bit of, so that these two approaches. Do you do one large contract? And I said initially the risk with that would be if there's going to be some delays in some of the aspects because the government is not ready to move forward on some specific pieces of work, then it means, for example, you'll have a supplier and you are locked down with a bit of a large contract. That supplier wants to finish that piece of work and move out, while, for example, the government is not actually ready. While if you go, for example, for a bit of a phased approach, which is more or less like the rolling on contracts, Valentina, you're mentioning, then it means you have the flexibility. You're more or less like you move along as you build it up. Yeah. So I think there are pros and cons, but I think I see those are. Yeah.
Fantastic. So we're very much coming to the end. I've got lots of other smaller, kind of more specific questions, which I'll be asking the presenters to answer kind of after the end of the seminar. After you close, you'll see that we have a small survey for those of you who have participated. I want to take advantage of one question we received asking about kind of how to get countries who are going through similar processes to speak to each other and share their experience and share their practical tools, and that is exactly the function that the online community is there to achieve, that socialprotection.org in general kind of provides an incredible platform for sharing documents, videos, kind of any type of tool kind of, and they're the ones to access webinar, and this is already a step forwards in terms of sharing experience across countries. So thank you very much to socialprotection.org. Thank you very much for DFAT for making this possible. Thank you very much, Winnie, Eva, and Richard, for joining us today, and the audience for following through an hour and a half with a few technical glitches, but we did make it to the end. Please do complete our survey, because it'll help forwards. We do plan to host a few more of these webinars, so we'll be in touch. Thank you very much, everybody, and goodbye, and hopefully see you another time.
Bye. Thank you and bye-bye.